Welcome to Friday's edition of COVID-19. Over the past 24 hours, Korea's daily tally has hit another high to record over 1,300 cases. Now, in response, the Greater Seoul area has been placed under the highest level of the new social restrictions starting next week. We start now with the broader pandemic coverage with our Kwon-Soa. Now, so we're ending the work week at a record high and fears about a further surge.
Right, Sunny. Concerns are high, running high ahead of the weekend as Korea has for the second straight day marked a record high in daily infections, and that due to a surge in the capital region. And that has prompted authorities to impose some of the strictest restrictions ever. We'll go into the details throughout the program today. But first, let's take a look at this number. 1,316 cases were reported as of 12 a.m. this Friday, the first time that we're surpassing 1,300 infections. And with that, domestic transmissions have also reached an all-time high at 1,236. And also, it's just the third time ever that we're seeing imported cases in the 80s as well. And for the third consecutive day, Korea is seeing more than 1,200 infections. And with that, the total number of cases has surpassed 165,000.
Right, and in response, as you mentioned and I mentioned at the start, authorities have issued the highest level of social distancing for the metropolitan region.
Exactly, Sunny, as health experts are predicting that we could likely see even further growing figures for the time being. Authorities saw the need to respond in a swift and decisive manner. That's why the metropolitan region, which was currently at level 2 under the 5-tier social distancing scheme, has now going to be jumping to the revised 4-tier scheme, the highest level in that system, beginning next week for 2 weeks.
The situation in the capital region does not meet the criteria for level 4 yet, but a preemptive response is important as we are seeing a clear spread. This decision also reflects the view of local governments that we need to raise our posture to level 4.
Now, currently, only the capital, Seoul, meets the criteria for level 4. As for the third straight day, Seoul is seeing over 500 infections. And also, Gyeonggi-do province is seeing more than 400 cases for the first time this year. Also, other places at concern, Incheon, of course, also part of the capital region. But also here, Busan with 58 infections. And also Daejeon, these two that I just named, have also recently raised their social distancing measure from level 1 to 2 under the revised system. And according to the level 4 social distancing scheme in the capital region beginning next week, all schools and kindergartens will turn to online instructions beginning on Wednesday until July 25th. So for students, that would mean until the beginning of their summer break. So with that, the Education Ministry is also stressing that teachers, instructors, and senior high school students should get vaccinated as fast as possible. And here we see the numbers of the vaccinations completed so far. 15.5 million people in the nation have received at least one dose of a COVID-19 vaccine. Meanwhile, over in Japan, the Summer Olympic Games will be held in an unprecedented manner with no spectators at Tokyo venues as well as most other stadiums, as a fourth state of emergency has been implemented there that will be in effect throughout the Olympic season. Let's take a look at the high increases around the world in many countries that are especially dealing with the Delta variant. Also, the U.S. seeing increases recently due to the Delta variant that has become the dominant strain there. Also here, the UK, Indonesia, and India all at over 30,000 infections, while Brazil saw the highest daily caseload with over 53,000 infections. And the total number across the world stands at 186.3 million. Those are the updates I have for now. I'll see you back after the government briefing. Sunny?
Right, so I'll see you back in a bit then. Right, now for a closer look at the government's response to the rebound in daily infections here in the capital area, I have our Kim Seung-Yeon joining me in the studio. Welcome, Seung-Yeon.
Good afternoon.
Right, now, as I mentioned, authorities have issued the highest level of social restrictions for this region. Tell us more.
Right, that's correct, Sunny. So the social distancing level has indeed been raised to level 4. This is for the capital area. This as Korea on Friday indeed reported its highest ever number of daily cases since the pandemic began. The country set a fresh record with 1,316 new COVID-19 cases, including 1,236 local infections. Now, this also was the first time that daily infections, as Hoa mentioned, were above 1,200 for the third straight day. Prime Minister Kim Boo-kyum announced that level 4 guidelines will be enforced in Seoul, the surrounding Gyeonggi-do province, and Incheon on Monday for 2 weeks. He called on all citizens to exercise rigorous prevention amid the growing crisis.
Stay home, don't meet others, and always remember to take all safety precautions. Protect yourself and your loved ones by getting tested, even if you don't have any symptoms.
Now, under level 4 distancing, if we take a look at the details, private gatherings are limited to a maximum of 4 people before 6 p.m. And just 2 people after 6 p.m. Now, this rule will come into effect earlier than others on Saturday, that is, considering the serious nature of the current situation. Meanwhile, events and rallies are prohibited and only one-person demonstrations will be allowed. As for weddings and funerals, up to 49 family members and relatives will be permitted. Now, as for entertainment venues, all bars, nightclubs, and similar establishments will be closed throughout the 2-week period. And in the meantime, restaurants, cafes, indoor gyms, cinemas, and concert halls will be allowed to be open, but only until 10 p.m. Furthermore, regarding schools, all in-person classes will be shut down. So this means a full transition to remote learning, but this will start next Wednesday, the 14th, to allow schools to reschedule their academic plans. As for workplaces, teleworking is recommended for 30% of labor pools. No spectators will be allowed at stadiums, and at outdoor sports facilities, there is a visitor cap along with a ban on eating. All accommodations must operate at 2/3 capacity, and all religious services will be held virtually as well.
I see. Seong-yeon, meanwhile, with regard to the future, that is with our daily tally, authorities are saying that things are looking quite grim.
Yes, we do have some grim forecasts ahead of us. In fact, health authorities are warning that the worst may be yet to come as the country grapples with the fourth wave indeed. Now, if the situation holds steady, though, KDCA Commissioner Jung Eun-kyung said daily caseloads could stand at around 1,400 in late July. She added that if vaccinations pick up pace and people diligently comply with prevention rules, the number could drop to between 260 and 415 in September. However, in a worst-case scenario, the country's daily new infections could exceed 2,000 by the end of this month.
The reproduction rate tends to accelerate when there's a wider outbreak. And if this is indeed the case, we may see around 2,100 daily cases at the end of July.
KDCA Chief Jung Eun-kyung also voiced concerns over the rapidly spreading Delta variant. Over the past week, the Delta variant accounted for 9.9% of new infections here in Korea compared to 3.3% a week earlier. For the greater Seoul area, the highly transmissible Delta variant accounted for 12.7% of new infections over the past week compared to 4.5% a week earlier. Commissioner Jung also had this to say in regards to the Delta variant.
We have been detecting more Delta variant cases recently, and we cannot rule out the possibility of the Delta becoming the most dominant strain here come August.
Right, which is also the case in most other countries. Meanwhile, on the vaccination front, Seong-yeon, I hear inoculations in the academic arena may start soon.
Yes, so of course the country's vaccination scheme must certainly go on. As it stands, high school seniors and teachers will start getting vaccinated beginning July 19th, and cram school instructors will be eligible to get their shots next week, according to the Education Ministry Thursday. Take a listen.
We will decide which vaccination centres will take charge of the inoculations for each school, as well as the dates, taking into account their curriculums and preferred vaccination schedules.
The Education Ministry also said that from July 13th to the 24th, cram school teachers and workers in Seoul and Gyeonggi-do province, numbering 210,000 people in total, will start getting their vaccines. The ministry added that schools can decide on their own whether to reschedule their summer break as well for better prevention.
I see. All right, Sung-in, as always, thank you very much for the coverage.
The pleasure is mine.
Right, and it's time now for the regular afternoon briefing on the COVID-19 situation here.
Today, as of today midnight, our new daily local infection stands at 1,316. And we can see that we have entered the fourth wave, and compared to the previous waves, we have high possibility of having more increases in the number of new infections. And we are also being prepared for a possible rise. Together, it is very unfortunate for me to have to say the following. The COVID-19 infection, in order to curb the widespread infection of COVID-19, all of the individual members of our public need to exert a sense of solidarity. So we ask you to cancel all non-essential trips and outings and minimize your non-essential trips outdoors, and please stay home as much as possible. Moreover, if you have any clinical symptoms of COVID-19, it is very important that you get tested as soon as possible. And at private sector and at businesses, we also ask you to refrain from having your workers go on business trips and having group meetings, and also please reduce the number of workers at your workspaces. Moreover, at multi-use facilities that are opened, we ask you to also ventilate the space on a regular basis when you have your AC on, and please also comply with the stringent quarantine rules, including the entry log for all of the users, and also please abide by the regular PCR testings for all of the managers and workers. And at hospitals and pharmacies, if you are visited by any patients who have clinical symptoms of COVID-19, please have them encouraged to get tested as soon as possible for COVID-19. Moreover, we need to also have the sense of responsibility, and we need to exert our full efforts to comply with the basic quarantine rules, like wearing face mask and washing your hands and keeping social distancing rules. And starting from this weekend, we ask you to refrain from having outings and meetings, including your visit to places of worship and others, and please stay home as much as possible. Right now, we need to also be concerted to overcome this crisis. Until now, even when we were faced with challenges, we were able to overcome them thanks to your concerted efforts. Once again, we are asking for you to exert that sense of solidarity and cooperation, and our government will also exert our full efforts to this end. Moreover, here are some details. First of all, on the vaccination front, we have some details. First of all, above the age of 55, those between the ages of 55 and 59, we will be beginning the reservation for the vaccination booking starting from the 12th of July. This is next week, and it will be carried out until the 18th. You could do so via our website. You could also utilize the call centers as well. And also, starting from the 26th of July, we will be providing you with the Moderna vaccines at some 130,000 hospitals nationwide. And we also would like to note that these are subject to change depending on our supply of vaccines going forward, and we will be also updating you on the details. And as for the details for the COVID-19 vaccinations for the senior citizens aged over the age of 60, those who have already booked their COVID-19 vaccination appointments. However, their appointments have been canceled. So if you have not been able to receive the COVID-19 the vaccination, we will also open the appointment booking process from the 12th of July until the 18th. And this will also be done on the same way through our website or our call centers. And also, as mentioned earlier, we will be providing the vaccines starting from 26th for this age age group. And as for the treatment, the remdesivir treatments here in South Korea, we have administered the drug to over 8,833 people here in South Korea who are being treated. And the Rekinora treatment, it has been also administered to over 5,200 patients here in South Korea as well. And also as for the antibody testings that we have conducted in the metropolitan area and all of the newly enlisted military workers, we have been conducting such an analysis for the time being. And from the residents in the metropolitan area, we have been looking at the patients who have visited the clinics, and we have been conducting the analysis for about 4,000 people, and we have seen that 36 people have tested positive for the COVID-19 antibodies. And also starting from May, 17th of May until the 31st of May, as for those newly enlisted military personnel, we have also seen that a total of 8 people have tested positive for the antibody out of some 3,000 people. And we believe that these antibody development were not developed through the vaccination, rather they have been developed through a natural process. As a result, in the metropolitan area, starting in the July, we have seen that the rate of antibodies stands at about 0.085%, which is a big increase from the previous dates of analysis, which only stood at 0.025. And we also saw a biggest rise in the young age group. And as for the newly enlisted military personnel, we did not see a significant change with the numbers standing at about 0.25%. And according to these analyses, experts say that until now in the metropolitan area, we have seen an increase of the number of infections, and this has been also implied through our analysis of the antibody developments. And until we develop our herd immunity through the vaccination process, it is very important that we need to also comply with stringent quarantine measures. This has been emphasized by our members of the experts, and the quarantine authorities will also continue to carry out such an analysis for these large places with large outbreaks.
네. 그럼 지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다. 출입 기자단에서 보내준.
Right, so that was Kwon Junuk with the Friday's afternoon briefing. What did he have to say?
Well, Kwon started with expressing regret for having to begin with calling on the nation's citizens to do the following, which are canceling any unnecessary gatherings for the time being, also minimizing movement and trying to stay at home as much as possible. And if people even have the lightest symptoms, they should get tested for the virus. Meanwhile, at workplaces, Kwon called on as less contact as possible and also to work from home if possible. He also had an update on the vaccination front, saying beginning July 12th, their reservation for people in their 50s, I believe it was for those in their later 50s, for vaccination will begin. And yes, he also mentioned that because we are now at the 4th wave of the virus, that everyone must cooperate in getting over this big hurdle.
Right. All right, so thank you as always for that.
Thank you.
Right. Also on the local front, authorities are dispatching mobile testing units to allow for aggressive and preemptive COVID-19 screenings amid the resurgence here in the Greater Seoul area. Our Chun Sung-cho is out on location with details on that. Hello, Sung-cho.
Good afternoon, Sunny.
Right. So, Sung-cho, where are you joining us from?
Well, right behind me, you see Gangnam Station exit number 11. I'm here today because a makeshift COVID-19 testing center has been set up since last Monday. Well, when you think of Gangnam, you normally think of it as a loud, young, vibrant district, right? So when you want to get as many 20-something and 30-somethings as possible tested for COVID, then this is a good place to start, certainly. Well, with a recent surge in infection numbers among those age brackets who are mostly not vaccinated because they don't fall into the priority group, well, the Seoul city government has decided to expand these testing centers, makeshift ones, especially in 3 spots in the district where they tend to get most crowded. And they also decided to expand the operating hours as well. So here, on a daily basis, around 300 people are getting tested. Testing capacity has rapidly expanded even on a weekday. And the average number of people getting tested in Gangnam-gu district alone has largely expanded. Well, the main idea is to have these test centers where the virus hits in large numbers. Seoul city government has decided to double the number of temporary testing centers in the city to over 50 and expand their operating hours as well. And the one at Seoul Station has been set up again after 5 months, and additional centers will be made in places like Gangnam Station exit number 8, Gupabal Station exit number 1, and Yeouido Park Culture Square. And for makeshift centers, there will be a total of 6 centers in the city, including a new one at Noan Culture and Arts Center. Well, unfortunately, we're seeing the number of new daily infections going up again, something that we've been trying to avoid at all costs. So please, again, if you show any symptoms, then do not hesitate. Get yourself tested, as these centers are widely accessible throughout the country. Every single one of your action will count and help push the curve in the right direction. This has been Chun Seung-Cho reporting live from Gangnam Station, and back to Sunny in the studio.
All right, Seung-Cho, as always, thank you very much for those details.
말 환자 수를 기준으로는 현 수준이 유지되는 경우에는 1,400명 정도의 수준에 도달할 수 있으며, 현 상황이 악화될 경우에는 2,000여 명이 넘을 걸로 예측을 하고 있습니다.
Indeed, there needs to be a balance between containment efforts and people's lives, especially given the prolonged pandemic. But in recent days, that balance is looking to break amid public fatigue and ongoing debate over possible exit strategies despite rising cases. Now, here in the studio, I have Dr. KimSeungTaek from Institute Pasteur Korea. Good to see you again, Dr. Kim.
Good afternoon.
And joining this session virtually is Professor João Malaia at Santa Maria Federal University over in Brazil. Pleasure to have you with us, Professor Malaia.
My pleasure. Good afternoon.
I also have Helen McArdle, a health correspondent, that is, at the Herald over in Scotland. Welcome, Helen.
Hello, good afternoon.
Right, then we'll start here, Dr. Kim, with a few questions on the local situation. How do you explain the resurgence here in the country?
Well, most of the infection recently is actually just found in the people in the 20s or 30s. And then one of the features of this group of people is they aren't actually vaccinated yet. And also they are actually probably less likely to just very less attentive to some personal quarantine, just the guidelines, because their risk of COVID-19, actually just very low in terms of just progressing to just severe diseases, so less likely. And then they are actually prior to this just current situation in the US and then Europe, after there some successful vaccination, just they actually try to move some more like some open just society. For example, like they are giving some incentives, like lift off just the mask mandate and things like that, and also some sports event. And so this kind of just global, just not just the global, just some the environments, circumstances in those countries somehow just directly or indirectly affect the people in Korea as well. And so, and then another factor we have to consider is the variant of concern. So recently, we are actually talking about many cases, we are talking about the Delta variant, but the variant is actually started with the Alpha variant that was actually began in the UK, and then now just South Africa and Brazil, now just the Indian variant, Delta variant. So although actually there's not much information is available for this Delta variant in terms of virology and then some basic research, but I think there seems to be somehow affect the some current trend of just an outbreak of just like some fifth or just a fifth or fourth just a wave of these the current situation.
Right. Now, Dr. Kim, as you mentioned, the local infections, the recent local infections here are centered on those in their 20s and 30s. Should we have placed our vaccination priority on these individuals from the start of our vaccination process?
I think some people are actually talking about the some rescheduling of the vaccination for those people, but I think the original, personally, I think we have to just stick to our original plan. Our just domestic guideline, especially for priority of vaccination, is actually almost equal to the guidelines of some foreign countries. We are actually focusing on the people with some high risk. Because if those people are just infected, they are likely to progress to the very severe disease and then even to just death. And but for the people in their 20s and their 30s, they are less likely to progress to the some severe disease. But we actually just weighing the benefit and the risks of the vaccination because of the vaccine supply is not really enough for most of the countries. So they are that's why we are actually just considering the priority. So personally, I think we have to stick to our original priority plans.
Right. Meanwhile, Dr. Kim, what are your thoughts on the social restrictions that have been imposed here in Seoul starting from next week? Do you suppose they'll work to perhaps stem the spread of our latest wave?
I think that was somehow, I don't know how effectively this will be, but I think at least it will be just effective. This is not just a complete lockdown, but considering just the current situation, that we have to do some impose some additional the protection at this moment, and this is pretty much just I think it's just the appropriate things, and then we also this is not just a complete lockdown, but at this moment we are actually considering some economy and then just preventing the further the spreading of these the viruses at this moment.
Right. Okay, then let's expand our talk now. Over in Brazil, Professor Malaia, could you start by telling us a bit about the COVID-19 situation in Brazil then?
Well, I was watching the show and it is very, very different from Korea. So we have now in Brazil some numbers that are very, very scary. So we have only 2.77% of the population of the world, but we have 13.25% of the deaths on COVID pandemic. So this is a very scary number. And we don't have, it is important for you to know that we have a complex political situation in Brazil. So we have a federal government and we have a Republican system when we have federations. And these federations, these state federations are made with cities. So we have three levels of power in government, a federal level, a state level, and a city level. So at the federal level, we don't have any measures of lockdown. We have a president saying from the beginning that it was only a little flu. He made a campaign against masks. We have last week our president in a crowd promoting crowds. That's all he does every day. So he promotes crowds and he was with a child and he took out the mask of the child. I think all the world saw this. And so he said bad things about vaccines, that he wouldn't take vaccine, that vaccines doesn't have 100% efficiency. So he would not buy coronavac vaccines because they were Chinese. There were delays on vaccine purchases. So things are very bad. We are not living in a country that we are feeling safe. We go to the supermarket, the supermarkets are crowded, people are walking on the streets without masks, restaurants are open. So the Supreme Court in Brazil had to made a statement and saying that state governments and city governments should be making some lockdowns and measures about this social distance. So we have this tension between state governments and federal governments that made an environment that makes people go to the street, thinks that things are going okay, that that this virus is going to take us all. So let's talk about herd immunity with no vaccinations. That's no problem. Everyone is going to take coronavirus. Only like our president say, only the people that would die will die. So that's very hard for us.
I see. And we'll get into that in a bit. But first then, Helen, what can you tell us about the spread of COVID-19 among the young unvaccinated people over in the UK amid the European Championship, which I believe is being held across 11 major cities, with the semi-finals and final at Wembley Stadium in London?
Yeah. So I suppose the first thing to say is obviously our vaccine rollout prioritise the elderly people, healthcare workers, vulnerable people first. So by the time the Delta variant started to take hold in the UK in sort of April and May, about 90% of people over 70 were already fully vaccinated. The vast majority, to be honest, of people over 60 were vaccinated. So really it was the younger population who were susceptible. And as the Delta variant began to spread, that also coincided with us beginning to lift restrictions on things like allowing people to go back into restaurants and bars, mixing more in their own households, schools returning, things like that. So what we've actually seen in recent weeks is that 80% of the cases we're seeing in Scotland are occurring in people who are 45 or under. We're only seeing about 2% of cases in people that are over 65. And then, of course, at the same time, we have in June begun the European Championships in Europe. A lot of those games being held in Scotland and down in London and Wembley. And it's coincided with record-breaking daily cases, the highest cases we've seen ever across the entire time of the pandemic here. And a lot of those cases, a disproportionate number, are being reported amongst young men in their 20s and 30s. Obviously, that tends to correlate with the football. In Scotland specifically, contact tracers were able to pinpoint that about 2,000 cases were directly linked to Euros celebrations in the first 2 weeks of those tournaments. Now, about 2/3 of those cases were people who were travelling from Scotland down to London, because Scotland and England were playing together at Wembley. But when they kind of boiled down how those cases were coming about, it didn't tend to be people who were going to stadiums to actually view the match. It tended to be people who had shared buses from Glasgow to London, people who were maybe sharing hotel rooms. It would be also people who were going to house parties up here to watch the games together, maybe gathering in pubs in larger numbers than before to watch the match on television. So it did tend to be that the cases were being linked to people mixing indoors, and not so much actually in stadiums, or even, to be honest, in some of the larger fan zone areas where people are getting together outdoors to watch matches on big screens. So undoubtedly the issue with the sporting events is that it encourages more people to get together
and to mingle
in environments that are dangerous.
Right. Speaking of football, Professor Malaia, Brazil also is hosting the Copa America despite its own plight with the pandemic. And the matches are, of course, being held in the absence of spectators, but they have been challenged by COVID-19 related matters, right?
Yeah. As I said, because we have this statement level, so the governments and states said we're not having public. The Copa America was going to be held in Colombia and Argentina, and these two countries said they would not held. So it was our president's kind of personal project to have to hold the Copa America here, And we have 4 times more COVID cases in Copa America than goals, for example. So we don't have public, but we have people working at the hotels, people working at the stadiums, people working with the teams. So we have been dealing with some problems. We have now more than 160 cases. But yesterday, one of the biggest newspapers in Brazil said that they were interviewing some specialists in COVID research in Brazil, and they couldn't get some numbers with CONMEBOL about the COVID tests. Only 38 cases were fully with the genetic research, 22 with the Gamma variant, but we don't know if there are all the numbers for us to reach what is the real situation in Copa America.
I see. That must be quite disturbing. Helen, Wembley Stadium is poised to welcome at least 60,000 fans for the European Championship final this coming Sunday. What has been the public response to this move by authorities there?
Well, I think it's mixed. There are obviously some people who are very keen to get back to normal life, and they see this as a sign of that. The 60,000 fans is going to be about 75% capacity. Now, the government argues that it's been carrying out research over recent months where it's been testing nightclub events, things like the Brit Awards, snooker tournaments, and it's been making them more safe by either only allowing in fully vaccinated people or only allowing people in if they've tested negative. Now, that's the same rationale that's being used for Wembley. So that's why the government says it's safe. Now, in fairness, that there are plenty of people in the public who are angry about this because we're still living in a situation where, for example, care home visitor numbers are limited. There's limits to the numbers of people who can attend weddings and funerals. There's even limits on hospital visiting. When someone is dying, maybe only one relative in at a time. So yeah, seeing huge stadiums full of spectators, even with mitigation measures to make it safer, is still quite controversial.
Right. Meanwhile, Professor Malaia, as you mentioned, the current administration's handling of COVID-19 is being addressed by the Brazilian Senate. Has this event served to perhaps raise stronger public awareness in Brazil about the need for tougher social restrictions, do you think?
Sunny, we have here a huge show on Brazil, on the world. It's the Big Brother. So here in Brazil, we are watching this Senate committee. It's like a Big Brother, you know. Everyone is watching. Everyone is following what is going to happen in Brazil and with this investigation. People are allowed now that our government made. They had a plan. The plan was to delay the purchase of vaccines, stimulate herd immunity by contagious, and don't made any measures of social distance and lockdown. This is the plan of the federal government that our Senate now is trying to review. And each day we have more revelations about corruption cases in purchasing vaccines, revealing this herd immunity plan. There is a shadow cabinet, and this is an expression used by people inside the federal government. And this shadow cabinet made a parallel, made some kind of it's like giving clues to the president in this shadow cabinet that is not official. So the health minister said, okay, let's have social distance, use masks, but we have this shadow cabinet telling the president that this is not the right measures to take. So the president doesn't take these measures, these technical measures at all. So this is the point now. And our Senate some of our senators are making a very, very important job now for the country.
I see, and I hope all things go well, Professor Malaia. Meanwhile, back in the studio, Dr. Kim, younger adults in Korea are poised to receive their COVID-19 vaccines after the month of August. Do you believe we should perhaps make these inoculations take place sooner?
I think it is likely to happen at this moment, and because there's some priority just setting just got by the government earlier. I think earlier this year or just later just last year, and we probably would not just change this original plan. But I think the people in the 20s and 30s, as I told you earlier, is less likely to develop the severe disease, and but at least we need to just still just maintain the some vaccination is very important in those cases, and especially for this the variant of concern, because according to the research from at least from the reported in the UK and in Israel, even for the Delta variant, after the 2 shots of the vaccines, the efficacy is pretty good, and so. The thing is that the total confirmed cases of the COVID-19 is just keeps increasing, but then the death rate is still very low, and that actually reflects the some very positive effect of the vaccination, the campaign at this moment.
Right, and staying with the vaccination campaign, Helen, what efforts are being made by authorities there in the UK to perhaps boost vaccination among younger adults?
Well, we haven't pursued a sort of incentivization strategy as such. You know, for example, parts of the US are giving out free beers or entering people into lotteries. We haven't gone down that route at all. But what we're doing at the moment in Scotland and in other parts of the UK is really just trying to make it as simple as possible for young people to get vaccinated. So having drop-in centres where people can just turn up without an appointment and get vaccinated. We're trying to bring forward second doses. So whereas they were being given at 12 weeks, they're being given at 8 weeks. We're also allowing people between the ages of 18 and 29 to go online and book their own appointments, as opposed to receiving a letter in the post with a specific appointment time. The idea being that maybe they're more likely to turn up if they can choose a time to suit them. And at the moment, I was having a look at the figures. At the moment, in the 18 to 29 age group in Scotland, we've got 62% of people in that age group who've had their first dose. At the moment, 19% in second doses. Obviously, really, with the Delta variant in particular, we want to get up as close to 100% as possible. So there's lots of advertising as well to really try and push people forward to go and get vaccinated.
Right. And Professor Malaia, given what you've shared with us so far, it appears as though the challenges that Brazil faces because of the pandemic are being complicated, that is, by political matters as well. Now, I understand this is a difficult question, but what would you propose then to better deal with the situation in Brazil?
Take out our president. That would be a very nice measure, but it's very complicated. We were talking about vaccines, and we are in the 67th place in the world in vaccines. And now we have in Brazil, I would like to share it with you, believe it or not, but we have a phenomenon in Brazil now that is the vaccine sommelier. So people go into the health public system and get into the line to get vaccines. And when it's time to get vaccine, people ask, what vaccine is that? Is that CoronaVac? I will not take it. Is that AstraZeneca? I will not take it. I just want Pfizer or another one. So this is the situation in Brazil that our president held us. He was always talking in his personal social media bad things about vaccine. So people are getting to the line and they are asking, what kind of vaccine do you have? So if you don't have the vaccine that I want, I will not take it. So this is very bad. So if I can answer you, Sunny, is with this president that we are now, things are not going well.
I see. You need to have better information perhaps for the public as well. Helen, meanwhile, the UK exit strategy, which comes despite the latest daily tally of over 30,000 cases, seeks to lift all COVID-19 restrictions from July 19th. Now, do you see this roadmap as bearing productive fruit?
I think that really remains to be seen. It's pretty controversial here. I would say different parts of the UK are following slightly different strategies, but certainly England is, as you say, removing all restrictions as of July the 19th. I think there's nervousness amongst public health experts that given that we have so many unvaccinated young people still, there are big risks about us having problems with long COVID, big problems where we're not vaccinating children. The plan seems to be to just let the virus spread and infect them naturally. There's also a sense that things like removing the mask mandate for no longer having to wear masks indoors is almost being driven more by ideology than anything else. It doesn't really seem to make sense. It's a basic mitigation. Why not continue that from July the 19th? And at the same time, the UK government is also saying that people who are fully vaccinated will no longer have to self-isolate as a precaution. And if they come into contact with an infected person, fully vaccinated travellers returning to Britain from amber list countries will no longer have to self-isolate. And the UK government has actually admitted that on its modelling, we might reach 100,000 cases a day just in England as a result of this, but they're arguing that it's a price worth paying for a return to freedom, what they're calling Freedom Day on July the 19th. But yeah, I'm not sure.
Right, so only time will tell then. All right, Helen, thank you very much for your thoughts. Professor Malaia over in Brazil, thank you very much for joining us live at this hour. And Dr. Kim here in the studio, thank you for being with us today. Right now, we are looking at tougher measures for the metropolitan region in the days ahead. So do seek to abide by all prevention efforts to ensure your health and that of those around you. Thank you for watching.